numbers of hypertensive patients? That question will be answered among many others right after this fact of the matter. The 2015 National Stepwise Survey for Non-Communicable Diseases reported that 1 in 4 Kenyans is living with hypertension, also known as high blood pressure. More than half of the population have never had their blood pressure measured. Blood pressure is a force that a person's blood exerts against the walls of their blood vessels, and the more blood your heart pumps and the narrower your arteries, the higher your blood pressure. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attack and stroke. Fortunately, hypertension can be easily detected and controlled by medication and a lifestyle change.
I got the hypertension in 2010. I was never told. It was discovered after I'd gone down with another condition now called stroke. And now this is when they went to check. Then they found, oh, this thing is too high. The doctors told me now, actually this is that condition. Probably what you are eating or what you are engaging in caused all this. And I agreed because all the time I was engaging in junk food. One, I was eating a lot of meat, eggs, beer. Occasionally I smoked. I accepted and now started that journey of treating and maintaining hypertension. I'm on drugs and they are doing very well. My pressure is quite okay, so I have no problem. When I came out of the hospital, the therapists were there. They educated me on this condition and how I could cope with it. And actually, it has really assisted me because, like, walking was a very big difficult. Doing things like washing or bathing rather was very difficult because I was not talking for like almost a year. We want people to know that hypertension is tricky because it comes unannounced. Let's change this lifestyle because without changing it, you end up like Evans and others who are in this condition.
So the cases of hypertension in the country have increased over the last 20 years. Why? We try to answer that question and many others right here on Health Diary today. We have Margaret Kilonzo, who is hypertensive. Yes, and is also a community health worker. And of course, we have Dr. Helen Guchu, who is a practicing cardiologist. Thank you, ladies, for joining me. Now, I'll start with you, Daktari. What makes the blood pressure go high?
It's a combination of how fast your heart is beating and how stiff your arteries are. Mm-hmm. So when the arteries become stiffer, that actually increases your blood pressure. Mm-hmm. If your heart has to pump hard for a variety of reasons, the blood pressure can go up. Mm-hmm. And there are various modulating factors that come in to affect those particular issues.
Okay. Now, there are two types of hypertension, primary and secondary. What's the difference?
Primary hypertension is basically, in medical terms, is the blood pressure which we are unable to find the reason why it has gone up. And usually is connected to age. So as people grow older, the blood pressure tends to go up. The secondary hypertension, there is actually an underlying cause. If you treat the underlying cause, the blood pressure will actually go. It will settle down to normal.
For you, you were diagnosed at what?
When I was 28 years.
Wow.
Now I'm 38, yeah.
And you're 38?
Yeah.
In her case, at 28, what could have been the reason?
It was because of the lifestyle.
Aha.
Yeah.
Explain.
I used to weigh 120 kgs. Okay. My lifestyle was not one of the best because I didn't focus on traditional foods. If you talk about salt, I used to take a lot of salt, especially raw salt. Red meat was my favorite, especially nyama choma. I didn't know I was trying to look for sickness. But by that time, I didn't have the knowledge. I didn't know the risk. So if you check about my food, it contained a lot of oil. About physical activities, I was not doing them.
And yet you are a young person.
Yeah.
Okay, so Daktari, name some other risk factors that put your crosshairs with hypertension.
We'll start with the ones you can't modify. Basically, increasing age, gender. Men are more at risk of high blood pressure than females. Genetic predisposition. So if your parents had high blood pressure, you're at a very high risk of also having high blood pressure. And then there are the modifiable risk factors. Excessive salt intake, lack of physical activity, excessive weight, basically eating the wrong kinds of foods. Okay, and then now we have the other ones where there's either a hormonal problem, which we can sort out, or basically there's something else going on, some drugs you might be taking that are actually causing your high blood pressure. Yeah.
Okay, before you were diagnosed at 28, did you have symptoms that you probably ignored for a long time?
I didn't have any symptoms.
At
I
all?
was just okay.
Okay.
Yeah.
And I asked this, Daktari, because I read up on this and they say you can live with the symptoms and not know that you have hypertension.
Yeah.
The problem with high blood pressure, we call it a silent killer because the only time we see the patient is when something has definitely gone wrong. Either one, they've gotten a stroke, they got a heart attack, the heart has failed, the kidneys have failed. So the patients come to us. By the time you're developing symptoms, things have gone horribly wrong.
Considering the health complications that hypertension causes, how long can those symptoms go undetected?
What happens is, I've noticed, if you talk to patients and ask them questions, you'll discover that they've been having symptoms, they've just been ignoring them. So someone will tell you, I've been getting tired, so whereas I could walk up 3 flights of stairs, I now find I can only climb up to 2. And the only time they come to you is when now, oh dear, I can't even climb up the first flight.
Okay.
Yes.
Men are more susceptible to getting hypertension that ladies are. You're a community health worker. Do you see the same on the ground?
Yeah, it's true because you find that men, it's not easy for them to go to be screened for blood pressure. They don't have that time. And after all, they don't have any symptoms, though. They don't go for the screening.
But now, Daktari, this is where I find it interesting. When you go to the doctor, one of the things you do at triage is check your blood pressure. So how come these things are not caught at that point?
If you were to look at the prevalence of hypertension in our country, you probably find it high in women. But the reason is because it's women who come to the hospital and get checked. So women have to come to hospital either because you need an obs-gynae check, or your child is sick, or your mother is sick. So men only come when they're actually unwell, and that's when you capture them. Yes.
With the numbers increasing, are we saying then it's because people don't go to hospital, that's why it's caught late? Or are we saying when you're told your blood pressure is not good at triage, people don't do anything about it?
Well, one, people don't show up, but two, for those whom we tell, they go into denial, and so they don't come. And they go for other options where they're told that their blood pressure is fine.
So when you were diagnosed with hypertension, Marguerite, were you in denial?
Yeah. 3 times.
3 times?
Yeah, because I was checked in the walkways. There was walkways which were started by HAMREF. The first walkway, I was told my blood pressure is very high. I ignored. I said, after all, I'm not feeling anything. These people are not serious. I just ignored. I went to another walkway. I was told the same. But that time I was referred to the clinic. When I went to the clinic, the results were just the same. So I was started on medication. When I went to the clinic, that is the time I agreed that I'm hypertensive. So I was started on drugs. After some times, when it is stabilized, I defaulted the drugs because I thought I was normal.
Denial, clearly, is a big part of why we're losing so many people to hypertension, or many people living with hypertension. But then again, even after diagnosis, the follow-up or the follow-through of the patients, how does that look like, Daktari?
You see, if you have motivated people, they will come for their follow-ups and their appointments as needed. And for some patients, I actually give them my number and tell them, call me if you're having any problem. However, you find that a lot of patients will take the medication, and in their minds, they think high blood pressure is like pneumonia. You're supposed to take the medication only for so long, and then you stop. And I've had interactions with various patients who tell me, I don't want to get addicted to the drugs. And I'm thinking, it's not an addiction. This is not an addictive drug. It's controlling a problem.
So apart from the patient being in denial, at times the healthcare provider might not notice that you're dealing with hypertension, right?
Sometimes, yes.
And what kind of conditions are this that we're talking about it might mimic?
Actually, our problem has been that, number one, educating the patient that this is independent of whatever other symptoms you're having, or this is actually directly connected to your symptoms. So if you come to me with a running stomach and I notice your blood pressure is high, you're more likely to dismiss the diagnosis of high blood pressure and tell me treat the running stomach.
Maybe that's why
maybe that's why the blood pressure is high. But that's not the case. But like for headaches, for example, you tell them, look, if you treat this, the headache might actually resolve. Sometimes it doesn't because the headache might be a migraine. Yeah.
You said there are genetic, you can be predisposed genetically or environmental factors, as we've talked about some of them. If then you are at risk, is it advisable to just randomly be going for checkups on your high blood pressure, or rather on your blood pressure?
Yes. It doesn't cost you anything. It's literally 2 minutes. And it can free you up in so many ways.
Yes. Okay, so where can I get these services if I wanted to do a random checkup of my blood pressure?
Most pharmacies, you can walk in and there's a blood pressure machine. You just ask to be measured. In the dispensaries, it's free of charge. In the chemist, maybe you'll be charged 20 shillings. You see, you can even walk into a facility. Like if you walk into a private facility and just say, I just wanted my blood pressure checked, no one's going to charge you for it.
Oh, you buy the machine?
Yeah. Or you just buy the machine. But the machine is expensive, honestly. Walk into any health facility and just request.
And you say what? As cheap as 25 shillings, you said?
Yeah. And some of them, most of them are actually free. Most people won't charge you for checking your blood pressure.
Yes. Okay, we're talking about hypertension, and clearly a lot of it is taking your own health into your own hands. More on hypertension after this break.
Crazy without your friends. Drink Fanta. Taste fun.
Mama, how can I be a champion runner?
Well, you've got to be like a geisha ball. Stay strong and go so far. Be strong and last long.
Like geisha.
Sensitivity is a short, sharp pain that people experience when they have something hot or cold getting to the nerve of the tooth, causing that discomfort. If the sensitivity is left alone, it may get worse. Dentists recommend Sensodyne to their patients. It's able to get inside the tooth and calm the nerve of the tooth down, and the proof's in the results. It works.
Je, biashara imekwama na hauna kakitu? School fees hauna na kumekauka? Au ni tokens zimeisha na huna cash? Usiworry, kwani unaweza chukua Senti. Senti inatatua mahitaji yako yote ya kifedha. Pate cash instantly. Terms and conditions apply.
I can't believe that we are the ones empowering people to destroy and cause trouble in our country.
Our country has long been destroyed.
Let's talk, Anna. We have a lot to discuss. Come on, come with me.
Let go of me.
What do you want from my wife?
When it comes to pimple care, Acne's Creamy Wash contains multiple vitamins and removes excessive oil and dirt. Use Mentholatum Acne's for clear and smooth skin every day.
Enjoy all your favorite NTV programs on all free-to-air set-top boxes and digital TVs. Catch us on ADN Channel 101 and 103, DSTV Channel 271, GoTV Channel 91, Zuku Channel 13 and StarTimes Channel 106. Download the Nation News app from apps.nation.co.ke to watch this live broadcast. NTV, turning on your world.
Every day, NTV News Team moves you to the center of the action.
The security forces who took part in this operation,
police are not taking anything to chance it.
Moves you to the heart of the story to witness and record history.
Rendering the declared results null and void.
Telling the story of Kenya.
The growing importance of border in Mandera.
Matatus will be on strike.
And beyond.
The politics in the United States capital.
It is the 7th edition of the Global Education taking place in Dubai.
When it comes to business, we crunch the numbers and unpack the detail with the latest information for your investment decision.
It's time to say goodbye to this note and karibu to this note.
In order for the manufacturing sector to be elevated from the ground.
Despite the government's promise to create at least 1.3 million jobs.
Moves you fast past the planes and trucks to bring you the triumphs and joys of our great men and women.
Moving stories that touch our hearts.
I didn't know that I could go back to school.
The Back to School program has brought hope to these young mothers.
NTV News. News that moves you. This is NTV.
Hujambo mtazamaji, hivi ni vipasho kwenye NTV jioni.
Mtu akishapata mamlaka kuu nyingi, akaheshimika, akaitwa bwana mkubwa, akaitwa excellency, akaitwa baba, sasa hapo ndio inaleta matatizo, anachanganyikiwa, anafikiria kwamba anaweza kusahihisha neno la Mungu.
Handshake yazidi kumkera naibu wa rais William Ruto, huku akimtaka Raila Odinga kukoma kuigawa serikali.
Code of conduct gives us authority to summon any publisher for them to explain the circumstances under which this book was recommended.
Matiba zilizochapisha kitabu cha wanafunzi cha Blood Ties kilichokuwa na matusi zatakiwa kujieleza.
Nikiona mwenye anakuja huko, mimi nakimbilia, mimi nasema huyu ni mtoto yangu.
Familia mbili huko Kericho bado zinawatafuta wapendo wao ambao ni polisi waliotoweka zaidi ya miaka 3 iliyopita. Na leo katika makala yetu maalum ya Mawi ya Mau tunaangazia jinsi baadhi ya maafisa wa serikali walivyowalaghai watu kwa kuwauzia ardhi ya msitu. Na mtazamaji, ni baadhi tu ya taarifa ambazo tunaendelea kukuandalia. Ifikapo saa 1 kamili utajiunga nami Doreen Majala kwa mengi.
Kisha tusonge mbele, kisha tusonge mbele, kisha tusonge mbele, kisha tusonge mbele, tusonge mbele.
Tusonge mbele na Fiber Mobile. Get a Fiber SIM card today and enjoy Tusonge mbele bundles at affordable prices.
NC Heights within Next Gen Compound Mombasa Road presents you with an opportunity to reside in one of the most exclusive locations in Nairobi. The 1, 2 and 3 bedroom units boast of adequate security, luxury, affordability and convenience. Join us for the 29th Kenya Homes Expo from 10th to 13th October at the KICC. Villa Care, we care always.
The Baby Band Fair is a unique event. I have seen its impact on growing families as it touches on parenting and specifically on women from different angles over the 3 days. As an exhibitor, I meet my objectives. It's a great place. I get to interact with my customers. Hope to see you there.
Come to the Baby Band Fair at the Sari from 4th to 6th of October 2019.
On the 27th of September at the Rift Valley Sports Club, My Network invites you for an informative, interactive, fun and exciting career fair. Please join us to interact with different stakeholders in the education industry. The theme is Education for Emerging Careers. Entry is free. For more information, call 0733 507 599 or send an email to projects@ke.nationmedia.com. See you there.
The Three Sides of Anna. Good day to you, Mrs. Salvatera.
I stopped using that last name after my husband died.
That's exactly the reason why this meeting is so urgent, Mrs. Salvatera.
Who do you think you are? I've been waiting for you for over an hour so we can get things ready for the meeting with a client who I'm sure will be here shortly.
Ana Lucia is mine, do you understand? I don't want you going anywhere near her again.
If you two are fighting over Ana Lucia, you're better off waiting for hell to freeze over. Because it's my guess that neither one of you will get to keep her.
The Three Sides of Anna.
Welcome to Turkana University College. Turkana University is a center of research, innovation, and technological development. Apply now for our January, May, and September intakes. Turkana University, the cradle of knowledge.
Welcome back. Our conversation today, high blood pressure or hypertension, if you may call it. And I still have Dr. Nguchu with us, and of course, Margaret, who's hypertensive and has been living with this condition for 10 years now, right? And before we went to break, there's something else I had in mind, Dr. and I need you to clarify this for me. I was reading up that they were saying high blood pressure or hypertension seems to be more in the African descent than it is in other races, if you may call it. How come?
We haven't quite twigged onto that. We still have to do our genetic studies. But basically, it's just an environmental, when you look at environmental studies, both in the US, you find that it's the African Americans who bear the burden of high blood pressure. And even when we do studies locally over here, there's a very high prevalence of high blood pressure compared to the other non-communicable diseases.
Okay, for you, Margaret, when you go to the community, people are talking about dealing with stress more, mental illnesses and all that. Do you think there's also a connection to the numbers we're seeing in terms of hypertension?
Yeah, because sometimes you see that if somebody has a stress, it's a trigger, the issue of high blood pressure. Most of the time, you just create awareness and tell them how to manage their conditions in order to avoid becoming hypertensive.
Find a way to manage your stress. You don't have to copycat what your neighbor is doing, but find the route that best works for you. That doesn't mean I'm telling you alcohol is the best route to take. No, but sports and physical activity and talking and counseling, you know, and group activities can actually help with management of stress. There is something, though, I also need to point out. We're seeing a rising number of children. We're seeing them rather obese, and we're going to end up with an epidemic of hypertension and other non-communicable diseases in those children. And that's because of the kind of foods their parents are giving them. I think we need to actually also address that. The lack of physical activity, schools that don't have playgrounds, the taking up of green spaces in the country so that even the schools that don't have a place where they can take the children to play. That should be addressed too.
And you will find, like, there are some regions in the country, if there's a high prevalence of diabetes, hypertension is, you know, somewhere in the horizon. And at times it could be because of their foods. For example, central region, because of eating tubers, they deal with more of diabetes, which at times comes with the hypertension. Can that also be something that people can look into?
Yes. There are actually numerous studies being conducted with regard to regional differences in prevalence of diabetes and hypertension. Because you find like the coastal region has a very high prevalence of diabetes, and the western region is more of hypertension, not much as diabetes. Central obviously seems to have basically both of them. The northern regions we're still basically trying to assess what is going on over there. We do have already a predisposition to getting high blood pressure. So we need to start looking very keenly at all the factors that are actually contributing to driving this blood pressure higher.
Okay, now uncontrolled hypertension can lead to various complications. Have you dealt with any, Margaret?
For me, no. No any complication. But in our support group, we have those people who have stroke because they defaulted drugs. Yeah. Others got stroke before they realized they were hypertensive. Yeah.
Okay. Dr. What does hypertension come with if not treated early?
The complications are, one, from the brain is obviously stroke. The heart, essentially heart attacks and heart failure. The kidneys is danger of basically kidney failure, therefore you go on dialysis. Even in the vessels of the legs, you can end up with peripheral arterial disease. It's basically dependent on the degree of high blood pressure and how well it's been looked after. Because I found very young clients, a 20-year-old who had all the complications, got a stroke, heart failure, kidney failure from the high blood pressure, you know. And he was only 20 and it was diagnosed when he was 18.
And what was the cause?
Now that was a problem, is that you see it's so expensive to run all the tests that half the time you focus the financial bit on treatment because some of the tests to find out the cause can be quite daunting for the family. Yeah.
When you were diagnosed, what did you go into?
I was just given medication. I had to change my lifestyle, control my weight, and also nowadays I try doing physical activities. I really work. Yeah, take a lot of water. I focus more on white meat, not red meat. Yeah, and everything worked for me.
The change of lifestyle, what is imperative?
Imperative is, one, get into some physical activity by all means necessary.
Okay.
Modify the diet. I don't usually give patients direct diets that they should have because it's good to first know what is available to them and you have a discussion with regard to that. Definitely reduce the amount of salt in your food, reduce processed foods in your diet, you know, check on your weight. We're actually having a weight problem. And I keep going back to that. We need to slow down. This weight gain is a problem. So you need to reduce weight where you have excessive weight.
When you're putting together your diet, what should be, you know, more than others?
Fruits and vegetables. Green leafy vegetables, by all means, have plenty of fruits in your diet. Eat plenty of nuts and seeds. Those are readily available. They don't cost much. Legumes, your beans, your dengus, your jahis, you know, all of those ones. Usually I tell patients eat white, but you know also sometimes red meat you need because of the hemoglobin. So yeah, so you can have a few
good
pieces,
balance.
a good balance. The whole idea is do everything in moderation.
Okay, so it is costly to manage hypertension. What has been your experience?
You know, taking drugs the whole of your life is not easy in the first place. And you see, like me, I'm very lucky because AMREF started a project where we get the medication for 100 shillings. But for hypertensive drugs, they are so expensive. There are some people who can't afford. You find that most of them just default drugs. Also the side effects. Because you find that in the support group, we realize that most of our men defaulted drugs because they said it was interfering with their sexual activities.
Oh.
So you find that they default, but they don't say.
So how do you counsel, you know, patients for them to understand, fine, you've got to be on these drugs lifelong, but these are the side effects that come with it?
Well, at least let me start off with erectile dysfunction. High blood pressure on its own, if uncontrolled, will cause erectile dysfunction. Yes, there are some drugs that will cause erectile dysfunction, but we also have drugs that will not necessarily affect it as much. So we always individualize treatment. So if I have a young man in front of me with high blood pressure, I'll definitely look for those drugs that won't cause him much of erectile dysfunction, okay? Obviously, if I have a pregnant woman, I have to consider that there's actually a fetus to look after. So her combination of medication will be completely different. Then there are asthmatics whom I have to consider. So everything is taken as a patient. We don't just give lock, stock, barrel, same drugs to each person. You have to individualize treatment.
NHIF insurance companies, do they help?
Insurance companies only give you so much of a limit, and you can find that you can bust your limit just halfway through the year. So like I said, it's a discussion with every patient. So you talk to the patient. For those who have a good cover, you'll give them of course, the top of the range. But for those whom you can see they'll struggle financially, I'd rather have you on drugs than have you not off. So I'll try and find you cheaper generics that I know will still work.
Okay, and your experience in the community, what are the other options that now people take up because of the expense that comes with the drugs?
If you check other communities, you find that most of them decide to go for herbal medicines. Others will believe that after they have been prayed, they are healed. So they just come to clinic when everything is complicated. Yeah.
Okay. And so what should be done at the county level to ensure that these patients keep to their treatment plan, considering all the factors we've mentioned?
Basically, with regard to the health policy, there should be at least a certain baseline minimum of drugs that should be available readily and at an affordable price to patients in every single government facility, so that even if you don't have money to buy from the private facility, at least a government facility has a medication. I'd like to see at least NHIF sort of expanding its cover to cover more people, to cover for these particular illnesses. If you can actually source the drugs at a very lower cost, it won't cost as much to actually give it to the patient.
Margaret, even as we finish, you've lived with this for 10 years, you're a community health worker, you are smiling and living healthy. What is your clarion call to those that are living with hypertension?
Being hypertensive is not a sentence to death. They should just maintain their adherence and live long. For those who don't know their status, please go and check your blood pressure. And if you find that you are hypertensive, please start your medication and life goes on. Okay. Yeah, it's just a condition like any other. Yeah.
Okay. Thank you, Margaret Kilonzo, who is hypertensive, and of course, Dr. Helen Guchu, who is a practicing cardiologist, even as we found out more about hypertension and the status of the same in this country. Time now for the health tip.
I like this leg workouts, squat workout using a Swiss ball. It works a lot on your glutes and your legs, and also side workouts with the Swiss ball up, working on your oblique area. The other workout you can do is a hamstring workouts, when you pull your hamstring, and it really helps a lot on your muscles. You should avoid a lot of jumping, a lot of running, anything that can be able to accelerate your heart rate. So you can be able to do aqua aerobics or aqua zumba, but it's very also important that you visit your physician before you do any other workouts.
At Health Diary NTV is our social media handles, Facebook, Twitter and Instagram. For any of your suggestions and comments, keep them coming through. My name is Gladys Gashanja. This has been Health Diary, coming from the Emory Hotel here in Nairobi. Until next time, see you.